Hey, everybody, welcome to Dental Voice with Zyris. My name is Rolando Mia. Today, we have a really special guest, Dr. William Moorhead. Now, throughout the last couple of years, dentistry has been going through all sorts of stuff. Probably the biggest issue is staffing, and everyone continues to do that. But now that we're kind of past that, one of the things is they're new members to the team. Efficiencies, trying to figure out how to make things happen. Dr. Moorhead has broken the code. So he's here to share with us what that's all about and how it can help you. Dr. William Moorhead, thank you so much for joining and really appreciate you taking the time. How are you, sir?
Rolando, thank you so much for having me. I'm looking forward to this.
So let's jump right in. And I really want to understand that when we spoke earlier, you created this context in dental practices about basically mapping out exactly what things have been like, maybe a checklist, right? And
Checklist, standard
how did that come
operating
about, and
procedure. How did it come about?
why is that so important? Yeah, why is that so important?
I had a near catastrophic event back in 2009 that just really changed my life. And I won't give you the 15-minute version, but the short story is I had a patient sedated, 70-year-old, used just a little bit of Versed in the IV, and he stopped breathing.
Ooh.
Well, the breathing slowed and slowed and slowed. And by reflex, I tilted the head back like you're taught in basic life support. And I reached for the oxygen and put it on. And I turned it on. And I stared at the oxygen and nothing happened. Fool with the knobs, nothing happened. We were radios in our office. I radioed. Somebody didn't turn on the oxygen. And what seemed like an eternity, maybe a minute later, they come back on the radio and say, "Doctor, all the oxygen tanks are empty." And so were the emergency tanks. And I didn't react well. In fact, I panicked, and that you never do in an emergency. It was a good learning lesson. Long story short, I was able, they didn't slap me in the face, but they needed to. But I got my wits together, and I was able to use a reversal agent and even save the appointment. The guy was fine. I got everything done. But that was a wake-up call that we had to change. I know now that someone had inventoried the oxygen, the big E tanks that are tall. We have three of them in the office. Somebody had found that a half of one of those was gone, enough for 2 weeks maybe. They called and ordered some, but they left it on. Someone else had left on the oxygen in the operatory. It drained it. About the same thing happened to the emergency oxygen. So we realized we had to change the way we were doing things. And there were other things that we were always making mistakes with. Sit down for a procedure and have to wait 3 or 4 times, stop the procedure and wait for them to run to get something. That doesn't happen anymore.
So wait. In the course of things, how often would you say that this happens in other dental practices?
At least daily, probably several times a day. Doctors, how often does it happen to you?
So when that happened, first of all, that would freak anybody out, realizing that, oh my goodness, well, this is a mess. What did you need to do to change that, and how did you get through that with your team?
We have opening and closing checklists that we use. So for instance, someone at the end of the day makes sure that there's a checklist at the end of the procedure to make sure that oxygen's off. I'm just going on this one topic, okay? They've got another checklist at the end of the day to make sure that all of the knobs are off and the oxygen switch is off in each room, that the tanks are closed. They have another list in the morning to turn on the oxygen and check to make sure that the nitrous and oxygen monitor is on and gives us a buzz if something's not working. But we run our entire office that way. I've had hand pieces absolutely disappear, and what had to happen to them is they got thrown out in the trash and nobody realized it. But now, before that person that's closing the office, before they leave, they count the hand pieces. If one is missing, it's simple. They don't have to stay all night and hunt for it. You just don't take the trash out and you hunt for it the next morning. Simple little things that you can introduce in the practice that make things error-proof.
And with regard to kind of creating this, how did you figure out which one? Is it just based on, school hard knocks and what you're dealing with, or is there a list that you went through? How did you get your team on top of all of this and create it? I mean, how does someone do that? It just seems so simple, but not really.
We started by creating checklists and gradually finding what we were doing wrong, adding to them, subtracting from them, making them more efficient. Um, a checklist is never a static document, and it's not something that can be in a binder that never gets picked up. I mean, a checklist for a trainee is good, but if it doesn't get used regularly, then it winds up relatively useless. Let me give you an analogy. We got the concept of these checklists from aviation, and there's a book that I'd strongly recommend. It's written by Atul Gawande. It's called The Checklist Manifesto. It's one of my favorite books. It's 80, 90 pages, easy read. It's not technical. It's how Atul Gawande, as a surgeon and the head of the World Health Organization, implemented the aviation concept in medicine. But think about it, doctors, as you're listening to this. You get on a plane and you know that even though the pilot does several flights a day, they're going to run that safety checklist every time. So what if you found out that they refuse to run the safety checklist because they're in too much of a hurry? You don't want to stay on the plane, right?
Right.
But the honest truth is we run our dental offices like that every day. And every situation is not a life or death thing like with the oxygen, but we make the same mistakes over and over again.
I'm curious, since you've implemented this, what effect or what impact has it had in your team, in your practice, and in the way you've been treating your patients?
Decrease stress. We're way more efficient. It improves the productivity phenomenally. It is a tremendous onboarding tool. And I'll have to share with you, since the pandemic, I have had every position in my practice turnover. I
Oh
practice
my
in a
goodness.
tiny town of 3,000 people. I'm an hour from the nearest city. I don't get experienced people here. But I also found that I'm better off hiring someone that works in Applebee's or a factory because I can teach them the way that I want them to do it. Now, doctors, you're saying, I don't want to hire somebody that's never worked in a dental office. It's going to take me 4 to 6 months before they know what they're doing. And that's the industry norm is if you hire someone outside of dentistry, it's normally going to take 4 to 6 months for them to be competent. I define competent as they know how to do it on their own, or they know how to look it up on their own. I can, by using the standard operating procedure checklist approach, I can do it routinely, clinically and business office, in 4 to 6 weeks.
Wow, wow. And you're comfortable with the level of understanding, you're comfortable with the operational, I'm going to call it skill that they have to do that?
They're still going to continue to learn, but you're not winding up with the watered down version where Jane trains Mary, who trains Lisa, and by the time the fifth person learns it, it's nothing like what the doctor taught them.
Right? Right? How does the team feel, or what's kind of the sentiment? Does it feel like a chore to them because it's like, oh my goodness, I have to go through all of this every time?
There are some team members that you can hire that have no attention to detail that it can benefit, but if they are an impulsive type and determined that they're more interested in visiting and talking than doing a good job, you're probably not going to reform that person. You got to pick people that belong in dentistry. You know what I'm talking about.
Yeah.
But for the right personality, which is most personalities, 3 out of 4 personality types on the scale, on the DISC scale, if you know that one. Um, because they're using checklists, it makes their job easier and it makes them look better
Mm.
because they're giving the doctor a standard of care all the time where they're maintaining that efficiency and making themselves look good and making the practice look good. It rewards them.
So wait, earlier you mentioned since the pandemic, you've turned all of your team over several times.
It was difficult finding the right people. When the worst of the pandemic was happening, people were job hopping if they wanted to stay in dentistry at all. You know, we've had a lot of loss there. But for the
Yeah,
ones
yeah.
I had any number that would take a job, it looked promising, and they'd work a half day, and I don't want to do this degree of detail. And we were shepherding them. We were nice to them. It's just, it wasn't for them. But we went through that a lot. And the number of people that ghosted me and even said they were, this was the experienced dental people. I'm going to take the job. They're going to show up that morning, and they don't even show up, and they block you on their phone.
Wait.
It is a different world now.
I'm sorry. I don't mean to laugh, but
It's sad but funny.
you can't. I mean, between you and I wouldn't even fathom doing that. I'd have the courtesy to say, hey, you know what? I had second thoughts. I'm not going to be coming in. They just disappeared and then they blocked you.
Yeah, it's generational thing too.
Oh my goodness! And now that you've got that in there, and you've got people on this checklist, and they're following it, how stress decreased beyond the fact that obviously they know what to do. What else is affecting it?
I've got a team that wants to be there, that interacts with each other well, that supports each other, and the checklists are part of this because it takes their stress away. You heard me say that we wear radios in the office too. They communicate regularly to help with setups and the like. We use a staffing situation in the clinical area. I have 2 chairside dental assistants, and I have 1 circulating assistant that comes in maybe 2 hours later in the day. She's turning around rooms all the time. She's setting up rooms. She works through lunch and takes her lunch an hour later so that the afternoon can be set up. And at the end of the day, she is there restocking, sterilizing, and the instruments for the next day's procedure are sitting in the rooms wrapped, the handpieces in Ziploc bags, the burr blocks in the same bags. They come in 5 minutes before our morning huddle, have everything open and ready. It is awesome.
I mean, that just seems so wonderful. If a practice isn't doing that and wanted to start doing that, it just seems like there's so many things. What advice would you give them to start? What are the things they can start and build on, like the first things?
I'm going to go at it from 2 standpoints. If you want to do it yourself, you start by looking at the most critical things, the things that you repeat that need the most attention. If you create standard operating procedures, doctors, for clinically maybe 15 procedures, you've covered 90% of your day. So it is, I mean, I've got templates in a software package pre-built that you can use, but I've worked on those for now 14 years. Yeah. I have a software product that you can buy that's a customizable cloud-based software. If you don't want to create it from the ground up, it's a very cost-effective way of doing it.
So it's a matter of starting with critical and then expanding from there.
Yes.
Let me ask this.
Look at where most of your mistakes happen. Look where you need predictability. Look where you need to train the new person. Look at your present needs.
So for people who are starting or whatever, or people who are going to get into this, based on your years of experience, what would you say are the top, let's call it 3 things, if not more, that you would absolutely caution people not to do?
Well, first of all, I'm having trouble getting past the years of experience, and I think I've been called, oh yes, I am old, sorry. The 3 things not to do. Hire the right personality types. Learn something like the DISC system for evaluating personalities. There are all kinds of other similar type things that you can use to find the right people. You've got to
wait. So when you say the right people, it's not just I like him or I like her.
You've got to have someone. You've got to have someone that's detailed enough to be able to do it. You want to balance the personalities in the practice, so everybody can't be the same rigid mold. But if they're an impulsive type that has no attention to detail, you're going to be beating your head against the wall.
Right. And you can figure those out, and those different
they show up quickly, yeah.
Can help.
But I give a personality test before I hire, or at least to that last person or 2 that I'm considering, to know how they think, and then work a trial day and watch how they think, how they interact.
Number 1.
that
Find the right people, make
find the right,
sure they are detail oriented, and they're the one. Okay.
find the right people. Second, doctors, you got to be positive with your team. Negativity breeds negativity. It will haunt you all your life. I came out of dental school, and I'm an 81 grad, so you can figure out the math. That makes me 37. Um, but I came in with this mindset of know it all. Everybody had to do it my way, and the
Yeah.
negativity that I brought from dental school killed me for years. If that's your personality, or if there's a hint of that in your personality, doctor, uh, counseling, do something to change. You won't regret it.
You
And
don't you
then
don't strike me as that kind of person who's my way or the highway.
I,
So
I'm a slow learner, but I'm thankful that experience and my faith has brought me to where I'm in a lot better place than I used to be.
so number one, find the right people. Number two, look at yourself, it sounds like.
Yes,
Because you can't, it's not about just you.
yes. And third, don't keep doing it the way you've been doing it just because it's comfortable. Look at different solutions on how you can improve yourself, your education, your practice, the people around you.
Wow. So that I want to dig into that just a little bit. That seems so easy to say,
Uh-huh.
but behaviors have a wonderful way of grabbing hold of you and never letting go. How do you work through that? Because the reason things are comfortable is because they're comfortable. So you have to break that. And habits are one of the most difficult things to break. What advice would you give people to be able to do that?
I'll just share what happened to me back. Told you I started practice in 81. About 97, I attended a verbal skills kind of thing. It was called Dental Boot Camp. It was run by Steve Anderson, that's still a consultant out there, and Walter Haley, that's deceased now. Uh, I I hope I sound like I've got good verbal skills, but I could barely talk myself out of a bucket back then. I didn't say things that patients could understand. I was in this doctor communication, doctoral level kind of communication with patients. No way to get anywhere. Um, and then once I did that, they challenged me at that course to start working on your education, improving what you did. I did Dawson Academy. There's so many good
Right, right.
Pankey's, Coy's, Spear. There's so many good programs. I added sedation to my practice, first oral and then IV. I've done IV since '09. I think I mentioned when I had that instance, the oxygen tanks were AWOL. But uh, giving yourself the chance to grow in so many ways will reward you in so many ways.
So
And
it's
I feel
about
so blessed.
challenging yourself. It's about making the commitment that, oh, well, first of all, how did you realize or recognize that you were doing it in a way that wasn't conducive to the way your team
Because I was miserable and I was making
supported?
everyone around me miserable.
And you saw how long did it take you to see that?
Way too many years. Way too many.
And what was it that finally made you see that?
Repeatedly finding myself losing a key staff member, um, not wanting to be in the. I love practicing now. I don't want to retire, and I'm 66 years old. But it would have been a different story 15 years ago.
So it kind of took getting to the point where you realize, wait a minute, all these people leaving, it's not them, maybe it's me.
Yes.
And that was kind of the tipping point. Oh, I love that. Find the right people. I could totally see that because there are different people that resonate with what you want, and you're right. That's completely important. Second, you got to recognize that there are things you have to put in place to do that, and then third, it's interesting that the third is kind of, it seems to me, the foundation of it because it starts with you.
It indeed starts with you.
Oh my goodness gracious! it's so gratifying to run into people who are willing to kind of look back at themselves and reflect and say, you know what, it was me, and it took a while to get there, but I'm there, and it's just awesome. If you were to take everything that we've been talking about, if you were to take the learnings that you've had and the stuff that you've kind of put together over the years and summed it up into something actionable that viewers, people watching this, could to walk away with and start, how would you kind of sum it up with them? What advice would you give them?
I think we've already mostly been over it, but it's look at yourself, look at where you are now, decide if you're happy at where you are now,
Mm,
and if you aren't, figure out what you need to do to get there.
I like that. Are you happy or not? And be honest with yourself, right?
Hmm.
And
Yeah.
then if you aren't, figure out something to do it. Now, you have built a whole program around that. And if I understand correctly, in addition to your dental practice, you have something called the streamline practice. And you mentioned something about templates and all that type of stuff. What is that?
The Streamline Practice is my consulting business, and the chief product of the Streamline Practice is a software called StreamDent. It's a cloud-based, customizable database that gives you pre-built standard operating procedures that are very easy to customize. It's a relational database, so you change something one place, and every place else that it's in there, it offers to change it for you. So it builds on itself. Got all kinds of videos built in that tells you how to do it. But let me give you some examples of what the checklist can do. Um, the new front office person that's been there 2 weeks answers the phone, and you're going to expect that she doesn't have good verbal skills. But what if she's got something in front of her that guides her, and she's just got to click away between a new patient call and scheduling the next patient and the recall or how to handle the emergency? And they get asked a question, and instead of putting them on hold and finding out what insurance we have, they've got to click that they can go to the FAQ section and have the answers to those kind of things. And the patient calls in with a clinical situation. They've got a temporary crown off, and they've never encountered that. So it's a put the patient on hold and walk back and talk to the doctor, and the patient's on hold for 5 minutes, right? Click on the special circumstances. It tells them exactly what to do. See if the crown's in, schedule them pronto, or get them in today or tomorrow and get the temporary crown back on. And it's got the time code there for them. You get the patient in for a new patient exam. And with the way we do with the templates and the software, doctors, you know that the polypharmacy, it's taking longer and longer for you to come in the room and be able to go over the medical history. But what if you could put at your dental assistant's fingertips every question that you would ask the patient to follow up? And they can ask those questions because it's in the software at a click. And they ask the questions for every yes answer in the health history. They put in the practice management system for you. You come in, you've got to spend 1 minute looking over it, and you're ready to go. You've got open-ended questions in there that prompt the dental assistant to ask the patient's motivating factors during an exam and the obstacles, and your case acceptance goes up.
And if I understand correctly, you can adjust, or you said customize it to the way you do your practice. So
And
as a
every
template,
practice
there's
does it
enough
different.
flexibility to do it. And I can see how much less stressful, because now I'm able to identify the things. And if you miss something, it's right there in front of you. If people wanted to reach out to you and ask you questions, would that be okay?
Certainly.
What would be the best way or the best method for them to contact you?
They're going to be putting my websites below us pretty soon. The streamdent.com shows the checklist software and how to get on that. There's a contact form on that where you can make a 15 or 30-minute phone call free and be able to find out more about it. I teach IV sedation in Kentucky. I'm a co-founder of a program that started in 2022. We take 10 per class. It is a tremendous practice builder, doctors. If you want to position your practice as the leader in the community, if you want larger cases, because the average patient that comes in that's fearful has put off work well, for every year that they put it off, they need $1,700, $1,800 worth of work. So it's bigger cases, and they really appreciate you, and they talk. You wind up building the practice because of your reputation of caring for those fearful patients.
And what's the best email to reach you?
Easiest email is dr.m, Dr. Moorhead, dr.m at streamdent, streamdent.com, dr.m at streamdent.com.
I love when there's structure, when there's definition, when there's clarity, makes things so much easier. And I love how you've been able to create that. It's incredible, now especially it seems even more prevalent in practices, especially with the fact that there's so many new people, new individuals entering into dentistry because of this, mass migration out during the pandemic. This is spot on, and I love that you're able to provide people with very specific things to do, and I think it's fantastic. I know that you've done a whole bunch of other things that I'd love to spend more time with you, but would you be willing to join us again and maybe cover some other things or kind of give us an update on how things are going a little bit later?
I would love to do that.
Oh, fantastic. Well, first of all, thank you so much for taking the time. Very, very busy day to basically, share your wisdom, share the experiences. The template process sounds so cool because now I'm not having to create, or people aren't having to create things from scratch. So I really appreciate folks. If, and we know who we are, we're running into these kinds of situations, please reach out to Dr. William Moorhead and contact him and follow up on that. That would be fantastic.
Ro, you started out the interview by saying Dr. Moorhead has broken the code. That's one of the nicest compliments I've ever gotten. Thank you so much. This has been so fun.
That's awesome. Thank you. Folks, thank you for joining Dental Voice. If you found value in what you heard from Dr. Moorhead today, please don't forget to hit the follow and share it. If you really, really liked it, let us know. Share it with your friends and colleagues. And we look forward to bringing you this kind of content and these kinds of experts in our other Dental Voice episodes. So we'll see you soon. Thank you for joining us, Dr. Moorhead. Everybody have a wonderful, wonderful day.
Thanks, guys.
Take care. Bye-bye.
Bye.